Hey everybody, today we're looking at the #1 treatment, hands-on treatment for eliminating heel pain. And my lovely guest here, Stephanie, has offered up her leg here so we can demonstrate a few techniques using some hard scraping tools. So we're going to get into that in just a minute. Here's the different tools that I have at my disposal here. There's all sorts of different types of scraping tools. Some of them are called Graston, some are called A-stem. These are just a different type. They're actually bison horns, which kind of makes me feel fancy when I use them. But different types of edges and surfaces depending on where you're trying to scrape and depending on how much pressure you want, depending on the person's tolerance, things like that. So I'll demonstrate a few of those. The areas that we're going to treat too, we can treat the heel and the plantar fascia, which is up here. So if you look at the three most common causes of heel pain, this is probably the biggest one. Heel pain right through there is usually your plantar fascia, and that's going to go up through here. Second most common we see is the Achilles tendon up through here. So you get Achilles tendonitis, tendinosis, things like that. The third one we see is along the inside of the ankle here, and you get different muscular tendons there just coming off down the side of your leg. So we can basically use any of these tools to treat any of these areas just depending on what we want to do. And the idea with this technique is that you're basically stirring up the scar tissue and the tissue in the area to instigate basically some inflammation. And the inflammatory process is going to be a good thing as long as you don't do too much, because it's going to kind of key in your body to send the healing properties it needs, get a little extra blood flow, things like that. For most folks too, it's actually fairly comfortable to do it. Once in a while, I mean, you'll get like a severe therapist who will just kind of beat the crap out of you, but I don't tend to do that. Kind of a nicer guy than that, but it works really well. So let's look at the technique. We'll use a little bit of just oil so that the scraping tool will slide around. And for plantar fascia, I like to use this kind of an edge here. And again, we can just kind of scrape in through the tissue there. Now, obviously, you can't tell on a video, but it's gritty when you scrape through. So right through there. Steph, do you feel okay?
Yeah.
Okay. So the plantar fascia is a big, broad ligament. It goes from the base of your heel up here all the way down to the base of your toes. Usually people that have the most pain with this are going to have pain right along the heel, right in there. Not too bad?
No.
And so we can kind of dig into it. The reason I love these scraping tools too is because I can't do this with my hands. I might be able to do it for a couple minutes. And I'm not necessarily a weak guy, although I'm not big and burly either, but it's just a lot of work to scrape in through that scar tissue. If I wanted to get a little more of an effective scrape on her, I could kind of flip her over and have her ankle down, and that would put tension on the plantar fascia. But this is a good way to start. So that's scraping on the plantar fascia there. If I wanted to go again to those inside ankle tendons, same thing there. So I'm not going to demonstrate that too much, but just through there. Okay, for the Achilles then, another good one. A lot of people with their Achilles are going to get pain down through here. But what we do with scraping is you want to get into the fascia, which is kind of a connective tissue layer, all the way up through the calf muscles. So all the way up through here. So when you first start scraping, we're just going to kind of get the tissue warmed up. Very comfortable. Still good there, Steph? Cool. And then when we get kind of more into it, we'll just go right into the tendon down here. And right where it attaches to the base of the heel there. Again, if you could kind of hear that or feel it, it's real gritty. And so we're just breaking up scar tissue. So again, all sorts of, what's that, Steph?
Feels good.
Yeah. And again, usually, I don't know, people see the tools and they kind of think, you know, the pain and torture, but for the most part, you've got enough surface area on a lot of these edges that even though you're getting a nice little inflammatory response over, say, 10, 15, 20 minutes, it still feels pretty good. So that, in my opinion, is the single best hands-on treatment technique for treating heel pain. Again, you've got kind of the three main types. You've got the plantar fasciitis over here on the bottom of the heel. You've got some, we call it like the painful triad over here. Sorry, not the triad, but you've got, they call it tarsal tunnel syndrome sometimes, but just the muscle tendons along there. And you've got your big Achilles tendon back here. Step back if you want to get a little more background information. You know, if you're looking at how to treat your heel pain, a lot of times it depends on where you're starting. So if you've seen some of my previous videos and blogs, you know, a good place for most people to start is with that information. Because if you can relieve all of your pain just by doing the stretches that I recommend or changing your footwear, things like that, then you may not need to do stuff like this. So I kind of say if this is, you know, you can't get over the hump, you know, you're doing everything that I recommend or that your other doctor or therapist recommends, but you can't get over the hump, this is the one thing that really can put you over the hump, because you can't tend to do this stuff on your own. You can do some self-massage techniques, and that's good too, but to really get in here and stir up the scar tissue and just get the inflammatory process going is difficult to do on your own. So there's other things you can do, like I said, stretching, footwear, taping, night splints, stuff like that. All that stuff works. But if you're getting stuck and you just can't quite get there, this should help. So if you got questions on that or you'd like more information on it, I'll leave the contact information in the description. You can always call the clinic 509-892-5442, or you can email me. And then next up, we're about to shoot a video too that's going to look at the best taping technique for getting rid of especially this kind of heel pain. So we've got all that information over on our blog page underneath the heel pain category, so feel free to go through all that. And as always, if you have questions, just reach out to us. That's what you got. Thanks for watching.